Tonight on KQED Newsroom, California imposes a new overnight stay-at-home order and travel restrictions as COVID cases spike, but vaccines shine a light at the end of the tunnel. As the pandemic surges in the nation and the state, we talk with the mayors of San Jose and Fresno about the impact of the virus on their cities and residents. Plus, we ascend the mosaic steps of San Francisco for this week's look at something beautiful. Welcome to KQED Newsroom. I'm Priya David Clemens. The U.S. reached a grim marker this week with more than 250,000 deaths from COVID-19 as the surge of new cases and hospitalizations strain healthcare systems across much of the nation. On Thursday, the Centers for Disease Control and Prevention advised Americans not to travel for the Thanksgiving holiday, citing the rapid spread of new cases, more than 1 million in the past week. Last year, 55 million Americans traveled for Thanksgiving. AAA says they expect at least a 10% drop in the number of travelers, which still means tens of millions of people will leave home, many carrying the coronavirus with them. Joining us now from San Francisco is Dr. Robert Wachter, chair of the Department of Medicine at UC San Francisco. Dr. Wachter, thanks for joining us.
My pleasure.
What's the level of your concern about holiday travel next week?
Incredibly high. This is a terrible time, unfortunately, during the pandemic. The virus is skyrocketing everywhere, worse in the Midwest than other parts of the country. California is a little bit better than some other parts, but there's a lot of virus everywhere. And if you had to design an event to create more and more spread, you would have a whole bunch of people come together from different parts of the country and take their masks off and enjoy a meal and have a few drinks and sit close together. That would be, if the virus wanted to have its own holiday, that's what you would design. So it's sad, but we need to do it very differently, or we're going to see more deaths than we should.
So how are you planning to celebrate Thanksgiving this year?
4 people, my wife, myself, and 2 children, a son and daughter, all of whom live in San Francisco and all of whom have been essentially in a pod ever since. And even there, we're going to keep more than 6 feet away around a fairly large table. We're going to order in from one of our favorite restaurants, and it's not exactly what we would do every year, but we want to be sure we all stay healthy and stay alive.
How do you recommend talking to friends and family who don't think it's particularly risky to get together, or maybe that it's safe as long as you get tested prior to gathering?
Yeah, unfortunately, the test is mostly, it's not completely false reassurance. If you knew everybody around the table had a negative test that day, I think you'd be reasonably comfortable that it's fairly safe to do, but the logistics of that are pretty darn hard. And so what you're probably going to see is somebody got their test 4 days ago and it took 3 days to come back, which means they were not infected 4 days ago, but doesn't mean today. The way I approach these things, Priya, is to say to myself, if things went wrong and somebody got very sick and God forbid somebody died, would I feel good about having done it? And obviously, we'd all feel bad about it, but would I say that was a reasonable decision knowing what I knew at the time? And I've told folks, I went and visited my 90-year-old father in Florida a couple of months ago because he's dying, and I felt like I wanted to see him alive before he died. I did it with my eyes completely open, and that's the question I asked myself. If I got sick, or more importantly, if he or my mother got sick because of it, would I feel like that was a foolish decision? And I felt like it was okay. But that's the test for Thanksgiving. And I think we'll talk about vaccines. I think it changes a little bit because there's a light at the end of the tunnel now. So we're not talking about doing this forever. We're talking about for this holiday, probably Christmas, but probably not next Thanksgiving. I think life will be much closer to normal.
Well, let's talk about the regulations that are in place right now. We see the statistics about the number of deaths, but there are still many who point to the survivability rate of 99%, and they think these regulations are overblown. Is there any accuracy in that line of thought?
Well, the accuracy is that the chances that you will die if you get COVID are relatively low. They're about 5 times higher than the flu, but it's not like you have metastatic cancer or you have Ebola or in the early days HIV before we had treatments. So that's accurate. Those chances vary quite a bit depending on who you are. So if you're a healthy 25-year-old, your chances are extremely low. If you're 75 years old or you're 50 but you have heart disease or you're obese, your chances are moderately higher. But the problem is that we're multiplying. If you have 10 people around the table, you're talking about all of those people having that chance, meaning there's a decent chance that one of them will get very sick. We also, maybe 6 months ago, we kind of dichotomized the outcomes as either you die or it's fine. Maybe you have a rocky, unpleasant week. And we now know that a fair number of people will also continue to have pretty bad symptoms for weeks or months. We know that if you do cardiac tests on people a couple of months out, even when they feel fine, we find abnormalities in a fair number of people. We have no idea what that means, and it may turn out that they have long-standing heart disease that ultimately causes problems years later. So it's not as simple as just dying or nothing. There's a lot of things that are that are other outcomes that we would care about. But I think the key point is, even if the death rate is about 0.6% all comers, that's a decently high chance of dying. I mean, it's not like walking across the street. It's there are a lot of risks that we take in life. We get in the car and we drive somewhere. We get on a plane. We go somewhere. But none of those risks, unless you're into hang gliding, are anywhere remotely like a 0.6% chance, which is about 1 in 150, that you will die. And so that's a pretty big deal.
What's your response to Governor Newsom's new overnight curfew for counties in the purple tier? It seems to be mainly intended to keep people from going to bars or from gathering together overnight. Why is that particular segment of the population important to target?
I think he's trying to sort of, as he talks about the dimmer switch, he's trying to dim it a little bit more without going all the way. But if things don't turn around, the case rates are going pretty steeply high right now. If things don't turn around pretty quickly, I think we will see more. But it's a reasonable idea to say, we're not going to shut down all gatherings. We're not going back to March and stay at home. But we are going to say that if you're going over to a bunch of friends' houses to go drink, that's a pretty risky thing to do. And as we try to move the dimmer switch to the right place right now, let's do this and see how things go.
You mentioned in a tweet recently that it feels like we're looking at a split-screen movie. On one side, the horrors of the pandemic, and on the other, the bright hope of a vaccine.
Yeah, it's hard for a human brain to keep those two thoughts and not have them clash against each other, because they really are. And the one screen is a surge unlike any we have seen before, worse than most of us had predicted. We all thought there was going to be a winter surge, did not think it would be this big, this broadly distributed, or this cataclysmic in the Midwest. It's not yet cataclysmic in California or in the Bay Area, but the Midwest is a horror show right now and getting worse. So that's something we have to grapple with. Yes, we have some better treatments. The chances of dying are a little bit lower than they would have been 6 months ago, but a whole lot of people are going to die. I mean, we're up to 250,000 deaths. That's hard to get your arms around. That's the entire population of Reno or Buffalo. We're almost at Orlando. And Scottsdale, Arizona, will hit Pittsburgh soon.
And I appreciate you
putting
putting that into that context.
On the other hand, you have this other screen that is showing this movie that is beyond anything we could have dreamed of. 95% effective vaccines that appear to be extremely safe and will probably start getting injected into people's shoulders about a month from now.
That's soon.
Yeah. So not everybody. It'll be prioritized. The supply is such that we're probably talking about 15 to 20 million people who can get vaccinated by the beginning of the year. And so that will be prioritized to older people at high risk and to healthcare workers. So if you are not one of those two categories, you're not going to get it, on January 1st. But it's highly likely these drugs will be approved by the FDA in the next 2 or 3 weeks and will be available to start being used by probably the 3rd week of December.
The vaccine news has been excellent, and at the same time, we've been struggling with the lack of a national response to the pandemic, a national strategy. Has the creation of the vaccines been helped or hindered by the Trump administration and his Operation Warp Speed?
Helped. And I have been highly critical of the Trump administration on COVID. I think they've gotten virtually everything wrong. I think, the messaging on masks, the craziness about hydroxychloroquine and bleach and everything else, it's just been, the whole thing's been mucked up, except for vaccines. Vaccines, they got it right. They basically said, we have these amazing pharmaceutical companies. If we give them money and say, you have no financial risk, just go out and put your best science and best technologies on this and do everything you can to get a vaccine out there in record time. And we will fund the clinical trials, which are very expensive, and we will fund the early stages of manufacturing and distribution so that the minute there's one ready to go, it is ready to be shipped. That was a pretty bold thing to do. It's cost about $20 billion, but when you think about it's probably going to shorten the pandemic by a year and get the economy back on track, a year before it might have been. It was a brilliant investment. So I think we should have nothing but praise for that part of the federal response.
And in the last very few seconds we have here, do you have concerns about the distribution and adoption of the vaccines?
Distribution, it sort of depends on how the federal government does it, and there's reason for concern, but I think we will probably get it right, and every state is gearing up to do it. I think the distribution will go okay. I mean, it's not going to be distributed to 300 million people on day one because we don't have that much vaccine, so it's going to take time for manufacturing to ramp up. In terms of whether people will take it, there have been surveys that said half the people won't take it. But those were surveys when it was a theoretical question. I think the question, if you ask someone a question, here's a vaccine that's been proven and truly proven, I think the results are clear, to be 95% effective, perfectly safe. You may have flu-ish symptoms for a day or two. And if you take it, you will not have to worry about going into a restaurant or going back to work. Your life can come back to normal. I'm guessing that 80 or 90% of people will take it. There will be some people that don't, but we don't need to get to 100%. We need to get to 70, 80, or 90%. And if I'm first in line as a healthcare worker who's about to start seeing patients at the end of December, I will be the first one to take it.
Okay. Dr. Robert Wachter, Chair of the Department of Medicine with UCSF, thank you for your time.
Thank you.
On Monday, California Governor Gavin Newsom announced that the state is, quote, pulling the emergency brake as coronavirus cases have rapidly increased. Now, 94% of California's population is under the most restrictive tier, color purple, indicating widespread COVID-19 transmission. We're going now to Santa Clara County, where the public health officer says the number of COVID hospitalizations is reaching alarming levels. Joining us now by Skype is the mayor of San Jose, the largest city in Santa Clara County, Mayor Sam Liccardo. Mayor Liccardo, thanks for joining us.
Good to be with you, Priya.
So in your county, there have been at least 6 deaths and more than 280 new cases this week. Could you describe the situation there on the ground for us?
Yeah, we're actually averaging about 300 now, and that's very worrisome for an awful lot of public health officials and for all of us, because we know that also it means the hospitalizations are ticking upward. We're now almost twice as high as we were a month ago, and that's of great concern to everyone. We want to make sure that we have adequate capacity in our hospitals, our ICUs, and so many of the very restrictive measures that are coming forward now are coming forward precisely because we need them, like so many counties throughout the state.
All right, well, let's talk about that. The healthcare providers there in San Jose, do they have the personal protective equipment, the hospital facilities, the ventilators that they need to respond to a coming surge of new cases?
Well, what I'm hearing from our county officials is certainly they're preparing as well as they possibly can, and they certainly demonstrated that they were able to be prepared in the last couple of waves. But the great concern is we just don't know where the peak ends. We haven't seen the peak stop yet in terms of the number of cases. And we know that means 2 to 3 weeks later, we will see those hospitalizations come through. And so what we're really emphasizing to everyone is get your flu shot in addition to getting COVID tested, because we got to make sure that nobody's filling those hospital beds with flu cases. We know that's going to constrict our ability to deal with whatever need may come our way with regard to COVID.
Well, as a mayor, you're concerned not only with the health of the residents, but also with their economic realities. And those are very intertwined these days. What do businesses and residents in San Jose need in order to pull through these difficult times? And do you, as a mayor, have the resources to provide what they need?
Well, bluntly, we need more money. And that's an easy thing for lots of politicians to say. But in this case, I think we all know that Congress has been deadlocked on providing any significant aid for several months now. We'd love to see Speaker Pelosi's bill pass, but we've got to get money in the hands of small businesses, of many employees who've laid off. We've got unemployment insurance that's got to get extended. People are desperate right now.
You know, the new unemployment numbers there in San Jose really don't seem that bad in comparison. The county is at about 6% unemployment.
Yeah, the 5.9% number that just came out would seem to suggest things are all getting better, but we know it really hides the cruel reality, which is that in the parts of my community that have suffered the most from COVID, with the most hospitalizations, the most deaths, communities like East San Jose, a high Latinx population, are also suffering from unemployment rates that exceed 20%. And so we know the tech industry is more or less doing fine. It's the rest of the economy, particularly the service industries, where so many of our modest income, low income residents are, where they're employed. We really need a lot of help to keep those folks, to help them survive.
All right, let's turn to the new overnight curfew the state has put in place. Have you directed your police department to enforce this new regulation?
Yeah, the police department is going to be enforcing to ensure that businesses are closed after 10 if they're non-essential, which is pretty much every business. We really want to make sure we're shutting down the restaurants in particular, any place where folks may be likely to gather socially in any way. You're not going to see officers pulling people over and they're driving, for example. It won't be, I think the governor's been very clear, it's not a curfew per se. This is a stay-home mandate. And we're not really that interested in getting officers engaged in, for example, stopping folks who are on their way home from work. So we're going to be very careful about this enforcement, really focusing on places where people might gather.
All right. Governor Newsom himself has apologized for gathering with others at a dinner party, and he acknowledged he may have lost some moral authority in the topic of social distancing. So I'm curious what you think about his actions and those of the California legislators who are in Maui this week, despite official warnings not to travel out of state.
Well, I learned a while ago, living in a glass house myself, I probably shouldn't be throwing rocks. And, you know, kudos to the governor for coming out and apologizing, being very forthright about it. I think he recognizes his error. And let's face it, we've all been there.
Mayor Liccardo, how will you yourself be spending Thanksgiving this year? And is it going to be any different than it was from a typical year?
Yeah, my family's a mix of Irish and Sicilian and Mexican, so we're a big, Catholic family. Lots of folks around, and it's not going to be that way. And obviously, we're going to miss a lot of folks. And we just had a newborn baby in the family, my nephew, and we're going to miss not seeing folks we desperately want to see. And so obviously, it's a painful time for an awful lot of families right now. We're just going to have to hunker down, do the best we can, and get through this. And I think there'll be a lot of celebration when we can get out on the other side of this.
And when do you see that other side coming? What are you saying to the people in your community about how long they should be holding on for?
Well, we can certainly see the light at the end of the tunnel. We just don't know how long that tunnel is. The announcements about the vaccines are very good, but we know that that's months down the road before those vaccines are going to be widely available. We expect there'll be other vaccines. It may be the case, and certainly I'm not the public health expert, but the treatments that we're seeing that are emerging will hopefully substantially reduce the mortality of this virus. That may enable us to open up sooner even than the vaccine. So I'm just, I'm rooting for science and technology right now. In the meantime, we got to do our best and keep the masks on.
All right, Mayor Sam Liccardo with the City of San Jose. Thank you.
Thank you. Always a pleasure, Priya.
We turn now to Fresno County in Central California, which has also rolled back to the purple tier. There, the sheriff and police have said they will not enforce the new overnight curfew. Joining us now by Skype from the city of Fresno is Mayor Lee Brand. Mayor Brand, thanks for joining us today.
Thank you for having me.
Fresno County Sheriff Margaret Mims, along with law enforcement in the surrounding counties, they've announced they will not enforce the curfew that Governor Newsom has mandated is going to go into effect on Saturday. And at least 2 Fresno churches have said they'll be open for services in person this weekend in defiance of those orders as well. Are you concerned that this resistance is going to lead to more cases?
I am concerned about it, but I understand both sides to it. I mean, we have my primary responsibility as mayor is to keep people safe in this city, and we're looking at a curfew that I'm extremely difficult to enforce. So what we rely on is voluntary compliance. Our police department has been stretched, like many law enforcement agencies across the state, and we're focused on a lot of serious crimes with gangs and murders and robberies and so on. So I've got to prioritize it. So there's certain things like restaurants and other industries that I don't think you've made the case yet, and it's, I think, somewhat onerous. And you're measuring the damage. People are overly fatigued by the COVID virus, and measure that against and everybody's learning more too as this thing progresses. But hopefully, we're getting towards the end.
Well, in addition to not enforcing the curfew, Fresno has said it doesn't plan to fine businesses that stay open during the day in a manner that doesn't comply with these new purple tier regulations. For example, they have more people in their establishment than are allowed. Why have you taken that approach?
The code enforcement is run by the city council. So my approach would be to basically try to educate people, get them on the right track, and not to be punitive. I can't guarantee that would be from certain council members, but I think the vast majority of businesses in this area are good people. They're doing their jobs. They're struggling to survive, and they're operating under the guidelines with social distancing, having plexiglass, proper air filtration, and so on. There was a Stanford study, in fact, recently about mobility, and it basically, if you're at the lower level of, say, 20-25% capacity, you're reducing the infections by at least 80%. In other words, you're basically the same at 25% as you are at having zero capacity. Why not let these guys have some way to make some money? And they're really on their last legs. And without any help from Washington, I see the whole industry being decimated. And that's going to have severe consequences. People can't pay their rent. They can't make their house payment. So I have to balance all those concerns out. It's not to diminish in any respect at all the severity of the virus that is taking lives. I've been there from day one.
Well, it sounds like you're saying you don't agree with the state regulations, and so you're going to do something different.
In a constructive way. I'm not advocating that people openly rebel, but we have to depend on voluntary compliance, and people have to trust their leaders. And we've been fortunate in Fresno for the past half year with some very divisive issues that we've all had to go through in an election, that we've kept together as a body and gave the message to the people of Fresno that we're united. We're looking after your interests. We're not overzealous on one side or the other. But as things played out during the year, no matter what you do, for me as an executive, this was like the year from hell. You had a pandemic, once in a 100-year pandemic, economic calamity. You had wildfires raging. You add pestilence on top of that, and that's what everybody's have to go through. All the mayors and the big 13 mayors, we meet almost at least once a week on a Zoom, and we all share stories. And whether you're from San Francisco or Los Angeles or Fresno, we're all having the same types of problems.
Yeah, not what you expected for your last year in office there. Let's talk about the numbers in Fresno. According to the Fresno County Public Health Department, there are more than 12,500 active cases in the county and at least 463 deaths from COVID-19. Tell us about your local hospital capacity, because the numbers are growing there, as they have been across the state and across the nation, and they are likely to continue to grow over the coming weeks. Are you worried about being overrun?
Well, it's always a concern, but what I've done, and we have a council subcommittee that meets every week, and I think we've done an excellent job on allocating. We had $92 million from a variety, from rent grants to contact tracers, more testing capability, PPEs, and so on. And we meet on a regular basis with Fresno County, which is in charge of the overall operation of Fresno. So I think we did a pretty good job we're about 300 or 400 short on our daily testing. We're opening new clinics. We're expanding our ability on lab ability to get turnarounds on tests from hopefully 24 to 48 hours. These are things we can do to make our people safe, and also improve the ability to track more precisely the data. Is it coming from nursing homes? Is it coming from neighborhood parties? Is it coming from bars and restaurants? I just don't want to throw the baby out with the bathwater. In other words, if we can't make the case, which I think so far, at least at the 25% capacity on restaurants and some of the retailers, I think we're being overly punitive and not really gaining that much in terms of reducing the pandemic.
Governor Newsom is apologizing for recently attending an intimate high-end group dinner. And in addition, news broke this week that California state lawmakers traveled to Maui for an annual conference. And this includes a state senator from Fresno, Andreas Borges. As an elected official yourself, could you share your opinion on why we should trust our lawmakers when they don't seem to be following their own directives to the public?
We've got to lead by example, and nobody's perfect. I made a mistake recently attending a small dinner, and it was just a cautionary tale that you can never let your guard down. You've got to set the example. And I think the same applies to Governor Newsom. Same applies to our state legislators. I mean, I don't know what the reason.
And your mistake was you recently had dinner with your successor, Mayor-elect Jerry Dyer, who has announced that he had coronavirus, and you have since quarantined.
Yes, and these are people I've known for like 20 years. These are not strangers I met and decided to go to a rally. So, but even that, people, when you're even your family, for my family this year, we have a very big family. It's typically 15, 20 people or more. We're going to break that up we're going to have just immediate family only. So it's going to be much smaller with much more precautions taken. So again, don't let your guard down. My advice to everybody else out there, I realize this is a really important time for people to get together. We're struggling, many people economically, but I think with the vaccinations and three major drug companies coming up, hopefully in the next 30 to 60 days, and a process started to reverse things, we've got to be diligent and keep the infections low, maintain our capability. We have a convention center that's an overflow that we haven't used yet.
All right. Mayor Lee Brand with the city of Fresno, we really appreciate your time. Stay safe.
Thank you.
And now for our look at something beautiful. Next time you're out for a walk in San Francisco, you could explore one of the city's special mosaic staircases, such as these tiled steps on 16th Avenue, built with community support. We want to take a moment to say goodbye and good luck to our show producer, Shiraz Sadiq, who's moving to Oregon with his family to embark on a new adventure. Thanks for everything you've done, Shiraz, and happy trails. You can find more of our news coverage at kqed.org/kqed-newsroom. I'm Priya David Clemens. You can reach me on Twitter, Facebook, and Instagram at Priya D. Clemens. We'll be off next week for Thanksgiving, so we'll see you back here in 2 weeks. However you celebrate, all of us here at KQED Newsroom wish you a safe and enjoyable holiday. Good night.